Well, let's head over to the Democratic Republic of Congo now, where a string of attacks on civilians in North Kivu province has displaced over 100,000 people and claimed dozens of lives in the last week. UN spokesperson Stefan Dujarric made the announcement during a news briefing.
According to information given to us by our humanitarian partners, more than 50,000 people displaced from Rutshuru found safety in Kibirizi, while some 55,000 people from Masisi fled to neighboring villages, as well as to Goma and towards Minova in South Kivu. Our peacekeeping colleagues in the country report that they've sheltered 95 children at their base in Sake. That's including 50 children from an orphanage. This happened following weekend clashes in the area between the Congolese Defense Forces and the M23 armed group. 4 civilians died during the clashes and at least 5 others were injured.
We're now joined by Jason Rizzo, Emergency Project Coordinator for Doctors Without Borders, based in Goma, DRC. Hi there, Jason. Jason, how bad is this displacement situation in the cities of Kaina, Kirumba, and Kanyabayonga?
Well, the situation in the north of North Kivu is particularly concerning. It's one of classic displacements, one in which people are fleeing unstable conflict areas to areas of safety. And in the process, they are traumatized and they are looking to have their basic needs met. So here we're talking about things like food, water, shelter, and access to medical care. We see that people are sleeping really wherever they can. So those that have family members or friends are staying with them. Others are staying in churches, schools. And for those that are in particularly dire circumstances, they are sleeping on the streets and they have nothing. They have no shelter, they're cold, no blankets, and they have nothing to eat. This is really the #1 problem that people are telling us when we talk to them on the ground, is that they don't have enough to eat. So this is really concerning. This is a population that is largely dependent on humanitarian aid at the very moment when humanitarian assistance has been insufficient in this area. This is particularly concerning for us as a medical humanitarian organization. Doctors Without Borders is seeing an increasing number of measles and malnutrition cases among children. And this is one of the reasons why we are launching an emergency medical intervention in the area. But it's important to note that we cannot handle all of the needs on our own. There are simply too many. And so we're calling on the rest of the humanitarian community to really mobilize and intervene to respond to the urgent needs of the population in the area of Kaina and the surroundings.
I was just about to ask you that, because we did hear that MSF says that it has observed a slowness in the humanitarian response. Why is that the case, though, Jason? And what is being done to improve the situation?
Well, it's a complex setting. We are talking about a situation in which people are constantly moving as the conflict evolves. So if one area that was previously safe falls into conflict, that means that the population is going to move. And that means that the humanitarian response needs to be flexible and move with the people to be able to meet the needs where the people are. That's a challenge when we're working in a conflict setting and access to different areas has been slow or has been cut off entirely. So at the moment, there's a no-fly zone that is in place. And that means that at the moment, there is no humanitarian flights that have access to this area, to the area around Kaina and Kirumba, where there was an airstrip that was previously being used. At the moment, that's suspended. We don't know when that will be reinstated. So we are doing everything that we can to bring in our supplies, medications, and personnel via different options. We are looking at ways of restoring airstrips to be able to bring flights into the area. But this is really a big problem, and one that is not only a problem for us, but really for the rest of the humanitarian community that needs to be able to respond. So again, we are calling on the rest of the humanitarian community to look into the severity of this situation, mobilize around it, and see what other solutions can be had.
And we do hope that those calls are heeded, Jason. Thank you so much for joining us on Africa Live. Jason Rizzo, Emergency Project Coordinator for Doctors Without Borders.